This lab will concentrate on different types of flexibility tests. There are several ways to determine one's flexibility, like the Canadian Trunk Forward Flexion Test, the YMCA Sit and Reach Test, the Chair Sit and Reach Test, and the Thomas Test. The equipment needed to perform these tests would be a flexometer, which is a sit and reach box, a yoga mat, a yardstick, some tape, a chair, and a ruler. It is important to warm up, preferably an aerobic warm-up for 5 to 10 minutes before performing these tests. Protocol for the Canadian Trunk Forward Flexion Test is as follows. Shoes must be removed, feet must be flat and against the flexometer. Knees should not be bent. As the person reaches forward with both arms fully extended and back straight, they must exhale and hold this placement for 2 seconds. They must also use both hands. Test is scored in centimeters and is repeated twice. The best of 2 scores is used. This test measures flexibility in the hamstrings and lower back. This chart categorizes by age and sex of the trunk forward flexion test using the sit and reach box. For example, I'm 22 years old and my score was 30.5 centimeters. My classification would be fair. The protocol for the YMCA sit and reach test is as follows. The participant must remove their shoes and the yardstick must be placed on the yoga mat and taped to the mat. Feet should be placed at the edge of the tape by 10 to 12 inches apart. When reaching forward, exhale with arms fully extended and hands touching the yardstick for 2 seconds. Lead in with both hands and knees cannot be bent. Scoring will be in inches and the test will be done twice. The best of 2 scores is used. This flexibility test is measuring the flexibility of the hamstrings and lower back. This flexibility test is measuring the flexibility of the hamstrings and lower back. The protocol for the chair sit and reach test is as follows. This test is used for older populations. A chair, 17 inches in height, will need to be placed against a wall. There is no need to take shoes off. One leg will be extended with ankle dorsiflexed while the untested leg is flat on the floor. The head must be placed on a normal alignment. When reaching forward, exhale and hold for 2 seconds. Another individual is needed to hold the ruler and assist. The test is scored in inches. The space on the big toe and fingertips is a negative score. The space on the big toe is a positive score. Touching the toes while reaching is scored as 0. This test will be repeated twice and the best of 2 scores is used. This test will need to be done on both the right and left leg. This test assesses flexibility in the lower back or the hamstrings. The Thomas test protocol is as followed. Lie supine on a yoga mat and bring each leg one at a time to the chest. If the leg that is straight on the mat remains in contact with the mat, hip flexors of that leg are flexible. Scores are measured as flexible or inflexible.